Interpreting an echo quiz just from a single frame has a lot of limitations, but still for an academic exercise we'll try. Unlike the ECG, where a single image may be more informative, echo usually requires moving images. And moreover, even ECG requires a knowledge of the clinical background before interpretation to avoid errors. Similarly, for echocardiogram, what we would do usually is first we will do a clinical history evaluation, then physical examination, and after that only we proceed with echocardiography in our routine work. But for an academic curiosity, we will just try to interpret an echo image which is a single frame only. This is an echocardiographic image from the parasternal long axis view. This is the location of the transducer and this is the sector scan. You can see the two-dimensional sector imaging from an echocardiogram. And I have marked out the aorta. This is the aortic valve in closed position. And mitral valve also appears to be closed in position. That is because the timing of the image may be in such a way that it could have been in such a way that both valves are in closed position. And this is the aorta and this is left atrium. From the images, we do not know whether the mitral valve is really fully closed or almost about to be closed. These are the features which are evident from this still image. So I'll give you a few moments to think about the possible findings over here and arrive at a possible diagnosis or differential diagnosis. I am sure that most of you who are familiar with echocardiography would have come at the diagnosis and differential diagnosis by this time because it is a very simple view. And this is a better annotated view. I am showing the ventricular septal defect here, right ventricle, left ventricle. You can also see the aortic override. The VSD is partly overridden by the aorta. So when there is an aortic override, if the override of the aorta is less than 50%, you think of tetralogy of Fallot. And if it is more than 50% towards the right side, then you think of another condition known as double outlet right ventricle, where both great vessels, aorta and pulmonary artery, arises from the right ventricle. And another condition which could have a similar view is truncus arteriosus, where there is only a single great vessel. I have labeled this as aorta, but from this view alone, you cannot be 100% sure whether this is truncus or an aorta. You require multiple views to see from where the pulmonary arteries are arising. Another finding here, which is not very clear, is that there is a suspicion of a conus here. Separation between the attachments of the aortic and mitral valve. This could be a conus tissue. But again, this is not obvious from this view because you should actually see the valves moving, aortic and mitral valves. Then only you know whether there is great separation from the hinge point. The shadows are here. You could also see some shadows in the left atrium. So this need not be a true conus. It could be just an artifact also because we are seeing shadows within the left atrium also. And if this is indeed a conus, that will be a point in favor of double outlet right ventricle than tetralogy of Fallot, because conus is usually seen below the pulmonary valve, and if bilateral conus are seen, it is a feature of double outlet right ventricle. Yet the override is not sufficient to say that this is double outlet right ventricle. Again, as I mentioned, all features should be assessed on moving film, moving videos, and not just a still frame. Here, there is also a suggestion of hypertrophy of free wall of right ventricle, which can occur in tetralogy of Fallot. So these are the differential diagnoses when you see an aortic override with a ventricular septal defect from the parasternal long axis view. Most common is tetralogy of Fallot, second is double outlet right ventricle, and still rare is truncus arteriosus. Clinical history would help in a way that if it's an adult, the chance of it being a truncus is much lower, unlike in an infant. So you would like to know whether this is an echo frame from an adult or an infant. And all the three are cyanotic congenital heart diseases.